Thank you. All right. Welcome, everyone. Thank you for joining us today for the Michigan Cardiac Rehab Network's second virtual telehealth cardiac rehab forum. And for those that are here to attend MVC's cardiac rehab work group, you are in the correct place. My name is Emily Bear, and I'm a Site Engagement Coordinator with the Michigan Value Collaborative, or MVC. And I'm really excited to have you here and a part of today's discussion. We will be recording this session, so please, if you are not a part of the presenting crew, keep yourself muted. We will have an opportunity for you to unmute and ask questions and be a part of the discussion after the demonstration portion of today's presentation. Okay. Before I introduce our presenters, just wanted to review a couple of housekeeping items. First, as previously mentioned, this session is going to be recorded, and that recording will be made available to you in a follow-up email to all attendees by the end of the day. We will also be monitoring the chat throughout the presentation, so feel free to add any questions into the chat as they come up, and we will have a designated discussion and Q&A session closer to the end of today. For those attending this meeting for MVC P4P credit, we look forward to your active participation throughout the meeting. That's going to include responding to polls, engaging in discussion, and asking questions that you may have. We will also share the post-work group survey at the end of today's work group. That link will be provided in the chat. It will also be provided in our follow-up email. As a reminder, within that survey, please note the hospital that you are attending this work group on behalf of. That hospital will be the site to receive your credit for attendance. All right, so today's agenda includes a few brief introductions, followed by a demonstration of group virtual cardiac rehab led by Henry Ford Health. We'll then close out the session with discussion and Q&A. Before we begin, I do want to thank the MiCR Coordinating Center team for collaborating to bring this forum to you today. It's been quite a bit of work to coordinate this. Our co-directors, Jesse Golbis and Mike Thompson, are going to be leading the discussion portion of today's forum. As a reminder, MiCR is a statewide collaborative led by BMC2 and MVC, with a mission to equitably increase cardiac rehab participation for all eligible individuals in Michigan. As a part of MiCR's 2025 to 2027 strategic plan, we're exploring new ways to support cardiac rehab programs across the states. One key area of focus for us is in virtual cardiac rehab. Our goals for this initiative are to understand how virtual cardiac rehab is implemented across Michigan, to identify real-world successes and challenges in telehealth delivery, and using data and feedback to guide the development of toolkits, training, and best practice sharing. Our first virtual forum was held on April 17th for those who were able to attend. That featured a presentation on the recent legislature updates related to virtual cardiac rehab and a guided discussion related to key concepts of virtual cardiac rehab, featuring two current virtual programs that are in action within the state. Some main points to come out of that discussion included that virtual cardiac rehab is not intended to replace traditional in-center rehab, but rather enhance it. That flexibility in care delivery models can help improve patient adherence and completion rates. Programs should be practical and individualized to meet patient needs and site capacity. And of course, that the extension of Medicare coverage through December 2027 offers a significant but finite opportunity to pilot, expand, and evaluate virtual feasibility at Michigan sites. If you're interested in learning more about that first forum, the recording will be included in the follow-up email that you will receive after today's presentation. All right. So to continue our conversation that we had at our first forum, we felt that the next logical step was to see this process in action. And so today we're bringing to you a demonstration from Henry Ford Health of their group cardiac rehab program. This demonstration is going to be facilitated by cardiac care leaders from Henry Ford, including Dr. Stephen Keteyian, who's a member of the Bioscientific Clinical Staff within the Division of Cardiovascular Medicine at Henry Ford, and Robert Berry, who is the Clinical Coordinator for Cardiac Rehab for Henry Ford Hospital. Joining Dr. Keteyian and Robert are three lovely patient actors whose faces might look familiar to you. These include MVC's engagement manager, Jesse Suva, who will be playing our patient Penny Valve, MVC and MiCR's project manager, Emily Woltman, who will be playing Vina Keva, and MVC's engagement coordinator, Rachel Folk, who will be playing Carrie Artery. For the next 10 to 15 minutes, Robert is going to lead Penny, Vina, and Carrie through a mock version of Henry Ford Health's group virtual cardiac rehab session. Okay, so I'm going to go ahead and pause sharing. I would recommend that everyone joining us transition their kind of viewing to the multi-speaker option, just so you are able to see Emily, Jesse, Rachel, and Robert all at once.
Okay, so we're going to go ahead and get our virtual session started here, folks. So just doing some housekeeping like we always do. Penny, are you currently at your home?
Sorry. Yes, I am.
Okay, and what'd you get for a weight this morning on the scale?
You had to ask that, huh? 212.
Okay, it's okay. And did you get a resting heart rate?
Yes, it was 68.
Okay, cool. And have you finished your 5-minute warm up?
I did. Thank you.
Perfect. I appreciate that. And Veen, I'm going to ask you basically the same questions. You're at the home that we have on file for you right
Yes.
now? Okay. And what'd you get for a daily weight this morning?
252.
Okay. And what's your resting heart rate?
74.
Okay. Awesome. And did you do your 5-minute warm up yet?
Yes, I did.
Perfect. Perfect. I appreciate that. And Carrie, last but not least, same set of questions. Are you at your home?
Yes, I am.
All right. And resting heart rate, blood pressure, or heart rate and weight?
Resting heart rate is 80 and weight is 200.
Okay. Um, and you did your 5-minute warm up already?
Yes.
All right. So we're into our workout here a little bit. Penny, what are you exercising on today?
I have my treadmill with me.
Okay. And how about you, Vina? What do you have?
I have my exercise bike.
All right. And Carrie, what are you doing for exercise?
I am doing an exercise video with some stretching.
Just stretching?
Well, yoga stretching.
Okay. Have you done that video before?
Yes.
Okay. Have you ever checked your heart rate? Where's your heart rate going to with a yoga video?
It's about 125.
Okay. All right. I guess we can get okay. Um, Usually we're looking for something that's a little bit more aerobic, a little bit more active than yoga would be. But if you're getting your heart rate up to 125, um, we'll roll with it. And Penny, what do you have the treadmill set at today?
I have the treadmill set at 2.5 with 2% elevation.
Awesome. All right. And Vina, does your bike display watts?
Doesn't know.
It doesn't display watts. Oh, oh man.
It's old.
Okay. So what does it display?
Um, let's see. I'm not sure how to make the display on my bike work. I just kind
Okay.
of set it. I can make the resistance go higher.
Okay. So what do you have the resistance set at right now?
4.
Right. And how hard does that feel for you? Is that
Uh,
fairly light, moderate, somewhat hard?
Moderate, but I could probably go a little higher.
Okay. Well, we're going to come back to that.
Okay.
Okay.
Yep.
Um, so, and Carrie, I just got your heart rate. So, uh, Penny, what's your heart rate on the treadmill?
On the treadmill, generally between 110 and 150.
I was kind of curious about right now.
Oh, I'm
Yeah,
sorry.
yeah.
Let me see. Yeah, so right now I'm at about 112.
Okay. And how hard would you say that feels?
Not too bad. I'm nervous to go any higher though.
What are you nervous about?
Well, I just had a heart attack and I'm so far from the hospital. I just don't want anything to happen, not be able to get there.
Okay, well, if something happens, nothing's going to happen, but if something did, okay, we have a policy and procedure in place for that. We'll have somebody there. Now, when we had the onboarding session, you might not remember, but we talked about making sure that the main access door to your house was unlocked. That
Mhm.
way EMS doesn't have to cave it in when they get there. You'll probably appreciate that.
Yeah.
Not having to get a new door. Um, okay. So are you having any symptoms right now other than just kind of like a little bit of uneasiness? Any chest discomfort, any shortness of breath?
No, not right now.
When was the last time you had those symptoms?
Oh, I was going up and down the stairs a lot and kind of got a little winded, but um, it went away pretty quickly.
Okay. So refresh my memory. When was this MI?
Um, it was probably, I don't remember the exact date. I would say it was about a month or so ago.
Okay. So you're still pretty early on in the recovery process. Okay. So I'm not surprised that you're getting a little bit winded going up and down steps. And something I would suggest when you go up and down steps is um, step up so that both feet are on the same step. And as you're stepping up, I want you to exhale, nice, firm, and strong. And then go both, first step up, second step up, exhale as you go. You're not going to have to do steps like that forever, just until we get a little bit further along in the healing process. Okay. But you're pretty much exactly where I expect you to be. Right.
Okay.
And the other thing is, when we get concerned about chest discomfort is if you stop, that's associated with activity. If you stop the activity and sit down and you're still feeling that way after 5 minutes, that's when we start getting worried. And when I say chest discomfort, I really mean anything from your waist up to the bridge of your nose. What was your symptom when you had your MI? How'd that feel? What was going on there?
I had a lot of pain in my right arm and I was feeling like really lightheaded and dizzy.
Okay. And is that how you were feeling when you were going up the steps? The same?
Yeah.
Okay. So I think you're just not quite there yet. That's fine. Usually from one episode to the next, um, the symptoms of having heart trouble are going to feel pretty similar. So if you started having that right arm pain, okay, and you stop and you rest and it's still there, you could do really one of two things. If you have a prescription for nitroglycerin, I would suggest you take one. Okay, kind of hang out for 5 minutes. If you're still feeling that way, take another one. And then that's when I would suggest that you call EMS, okay, after you take that second nitro. If you don't have a prescription for nitro, we can just see how we feel after 5 minutes. And I really mean 5 minutes, like 300 consecutive seconds, not like the end of the TV show. Not, I'll see what happens after the load of laundry comes out. 300 consecutive seconds, call EMS. It's better to be safe than sorry. Nobody wants to see anything weird happen.
Thank
Right?
you.
Yeah, you are.
helpful. We
Okay.
feel better.
Well, we try to be helpful sometimes. And Emily, how are you doing? What's your heart rate on that bike?
Let's see, 117.
Okay, so um, how hard does that feel for you?
I don't know. I mean, it's it's okay. I feel like I could do more. I
Okay,
just want to get back to, you know, how I used to be.
okay. So I'm listening to the way that you're talking to me, and you're not clipping your words off at the end. You don't sound like um, you're not short of breath at all. It's okay to be able to hear yourself breathing.
Mhm.
Okay, that we actually want you to be able to do that. You hear yourself breathing a little bit harder than usual, but not out of breath. So if I came up to you, you could talk to me, but if some reason I was like, hey, Vina, um, I really need you to sing the first part of the Star Spangled Banner right now. You might come up a little bit short of when doing that. You might not be able to get all the words
Yeah.
out, and that's the line that we want to walk, and that's called the talk test. And it's a great way to keep track of how hard you're working. So if you want to go up, you're on a 4 on the bike earlier. What's the next setting up?
Well, a 5.
Okay, well, it might have been 4.5. It was a fair question. Okay, so why don't you go up to the 5 and see how you're feeling? Okay, Carrie, how's that yoga treating you?
I'm doing okay. I'm having a little bit of shortness of breath when I start moving too fast.
Okay, in any one particular position? Are you flexed
Uh,
forward or you're bent to the side?
yeah, when I bend over to touch like my toes, then I have to come back up. That's when it kind of feels difficult. Um,
Okay, so couple things just keep in mind. A lot of times, have you been doing yoga for a while? It's just like kind of like your thing, or is this no?
Here and there, I wouldn't say I do it on a schedule. I just do it kind of when I feel like it.
Okay, so sometimes when people are doing something they're not real familiar with, subconsciously they hold their breath. So first thing, make sure you're not holding your breath as you're bending down to reach your toes. So that's exertion. We always want to exhale with exertion. So go down, all right. And then when you come back up, okay, but give yourself a second because you change position. We don't want you getting any dizzy or lightheaded on us.
So Robert, can you hear me? Stephen Keteyian here.
I can hear you, Stephen.
So I'm just going to jump into this conversation. Let's say I crashed your party and I had two questions I wanted to ask you. One is, I've been exercising regularly at home in the other class that you have me in, but family's going away for Alpena for a couple days and then we're going to Florida. Can we just dial me into my routine class while I'm in Alpena and Florida?
Alpena wouldn't be a problem. Florida would be. Um, based
I can connect the same way with my tablet in Florida.
Yeah, the issue is not it's not a connectivity issue. It's more of it's a regulatory issue. So the provider has to be licensed in the state that the patient is physically in, and we don't have any providers at Henry Ford that are licensed also in Florida. So
And my other question was, when I saw my physician assistant yesterday, they cut my beta blocker by one half. Is that going to affect what I'm doing now with you?
yeah, I mean you might see some higher heart rates. Where have you been going with your heart rates before they cut it? What
So
were you getting up to?
I was training typically on the treadmill at 110.
Okay, so let's keep an eye on that and see what you get when you're training on the treadmill with the same workloads, all right? And then the same thing I told Carrie about the breathing. Okay, we want to make sure we're breathing properly. But with a,
I don't need to come in to see you then. We can just do it.
um, you don't need to come in urgently. I mean, if you want to train, if you want to really train at the highest level that you possibly can, it sounds like you do. The best thing we could do would be bring you in, give you a stress test, and get a new target heart rate range because of the medication change.
Okay, thanks. I'll jump out now. Thank you.
All right. All right. So everyone's kind of we've got like everyone's got information off of everybody. Does anybody have any questions while we're kind of hanging out here? And I mean our simulated patients.
You have a question?
Sure.
Yeah, you told me a little bit about how to know, if I start feeling symptoms that I'm pushing it a little too hard. But when will I know if it's safe to push harder?
So it's a really good question, but really it goes by how you feel. Okay, you're still 4 weeks out from that heart attack. Okay, that should be getting a little bit better. So I think of the heart attack as being like a really bad bruise on the heart muscle, and it's going to get better, but it's going to take some time. So, and I'm really super dating myself with this analogy, but stick with me for a minute. Um, if you're Nancy Kerrigan and you just got whacked in the knee at the skating trials, do you go to Ford Field and run steps that weekend?
No.
How come?
Well, my leg's broke.
Well, it's not broken, but it's sore. All right. And the point being, it's injured. Okay, and it needs time to recover. Okay, you have a heart injury. It's going to need time to recover. As you're going through the progression, you're going to start to have more energy, and you can push yourself a little bit more. If you push yourself too hard, Penny, you're not going to cause another heart attack. But what's going to happen is you're probably going to feel really tired and washed out, and that's your body saying, "I wasn't quite ready for that yet." So give it a couple days before you try that again.
Okay. All right. Thank you.
No
And then
problem.
how do I get in touch with you guys between virtual sessions?
Okay, good question. So I know you got a lot of stuff with the onboarding
Yeah.
materials, but I gave you my card. It has a direct line to my office.
Okay.
I'm an all cards on the table sort of guy. I am often not in my office. So if you leave a message, I'm really good about calling people back that same day. If it's an urgent thing, then I would probably call your physician or call 911. I wouldn't try taking a risk on getting a hold of me.
Okay.
Does that
Yeah,
help?
I'll have to find that card. Yeah. I
Okay, I can
can
send
get a
it.
little scared.
I can send it to you through my chart or something. I'll just send you my direct line if you can't find it.
Okay, good. Thank you. That'll be helpful.
Okay,
I have a question.
sure.
Um, so sometimes I feel really, really tired on days that I'm supposed to do my cardiac rehab. Should I continue to do the cardiac rehab even if I'm feeling really tired and my energy is low?
So I think what we have to do is we have to keep the big picture in mind. Okay, and the big picture is that you feel better and you can do more stuff. That's why you're in cardiac rehab. If you feel worse after exercise and you're doing less stuff, like you have to take a 4 hour nap after a 40-minute yoga session, okay, we need to stop and reevaluate our plan. Otherwise, I'd say as long as you don't, you're not physically ill and you don't have a fever or something like that, I would come in and I would do what you can. Maybe that day you don't do quite as much as you usually do, but being consistent is really important. So I'd rather you do what you can than skip the whole day if possible.
Okay, thank you.
All right.
I have a
All right.
question.
Good.
So I sit at my computer all day. I work from home. I'm just wondering if you have a recommendation for continuing my progress, even though I really don't have a reason to move all day.
So kind of going back, big picture sort of stuff. What we're shooting for, and if you don't trust me, 'cause I just sound like some kind of shady clinical exercise physiologist, dude. Um, you can Google this, but how much physical activity should Americans be getting? And you're going to find a statement from like the American College of Cardiology and the CDC and all those folks that you should accumulate a minimum of 150 minutes of moderate intensity exercise every week. The operative word in there is accumulate. So how you do this is really up to you. It could be 5 days a week for 30 minutes. It could be 3 days a week for 50 minutes. It could be 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the evening. That would all count for 30 minutes. While you're working from home at your computer, you can just get up and walk around the house, just at once an hour, go for a 5 minute walk. Okay. In an 8 hour day, that's going to be that's 40 minutes of exercise that you wouldn't have got otherwise.
Yeah. Okay. Thank you.
All right. Anything else? We're getting
I,
close to the end of the session.
I have one more question.
Sure.
When and how do I share my tracked vitals and symptoms with my providers?
That's a good question. And were you sharing those? Have you been sharing those with them regularly?
When they ask me to, I do.
Okay. So I would, anytime they ask you to, obviously, anytime something just doesn't seem quite right. Okay, you're just like, I'm more tired than I should be. I just, whatever it is, and I know you're really good about, taking your pulse and writing down your heart rate and all that kind of stuff, which is fantastic. It's good information to have. Your provider can't do their job if they don't know what's going on with you. Okay, so for sure, when you don't feel well, okay, let them know. You can message them through MyChart or however you communicate with them, or you can just take a log to your office visits with you. Okay, and say this is like trending. What's going on?
Okay, thank you.
All right. I think we're getting kind of close on time, so everybody should probably be starting their 5-minute cool down. All right. And is anybody's heart rate more than like say 5 beats above or below what you gave me earlier?
Mine is, but I was going a little faster than I should have for a minute there, probably.
Okay. So what is it now?
Well, right now I'm at about 120, but it's coming down
Okay,
in my watch.
okay, you started your cool down.
Yeah,
Okay, so 120 is the highest you saw.
yeah.
Okay, you're getting credit for 120 for today's workout, man. Go you.
Okay. Thank you.
All right. So I think unless our virtual patients have anything they want to bring up, I think we're going to switch back to the MIC CVPR lecture thing.
Thank you.
Great.
Thanks, you guys. You guys are good sports. Appreciate it.
Thanks so much, Robert. That was lovely. And thank you again to Jesse, Rachel, and Emily, or Penny, Carrie, and Vina. You're getting lots of applause here. Let me just go back to sharing my screen. And we are going to move into the discussion portion of today's presentation. All right.
Great. Well, I just wanted to echo all of the comments. Thanks to our volunteers and to Robert and Stephen and Emily for the seamless execution there. So I think we're ready now to get into the question and answer. Did you have other slides, Emily, or are we good to jump in with it?
Yeah, I have 3 polls, but we can
Okay.
kind of space those out like during the discussion and Q&A if there were any sort of immediate questions that we wanted to get into. I'm working on pulling all my things back up. Checking in on the chat to see what questions might have come in.
Sure. Well, maybe if you want to pull that up, we can get started maybe with the questions and then
Yeah.
we'll take a pause when we're a few in. I think we've had a robust chat going on. So I think we'll start with those questions that we have and then open it up to the larger group. I also just wanted to point out that we have some folks from Michigan Medicine here as well, that you saw during our initial webinar a few months ago, Diane Perry and Sam Fink, and we do a little bit of a different model to these virtual cardiac rehab sessions in which they've been doing one-on-one sessions with participants or with patients, excuse me. So one exercise physiologist, one patient, once a week. And so if you have specific questions related to how that may be different from the group session that you just saw demonstrated, they can speak to that as well. With that, I will get into it. So I think the first question was from Stephen Kramer, said AACVPR presented on virtual cardiac rehab and the need for the patient to be at their billing address for rehab. Are the regulatory standards different for Michigan? Stephen, maybe you want to speak to that one?
Yeah, Robert can chime in, but I believe in Michigan it's exactly the same. You have to be at your home address. If that was the question, Robert.
So that's true for all of our CMS beneficiaries, but if you had HAP or Blue Cross Blue Shield insurance, which covers virtual rehab, um, that's not that's that requirement's not in place. They could
Good point.
be they
Thank
could be anywhere. We have people at Planet Fitness.
Um, I think the next comment or question, excuse me, said, do participants need to sign a special release form in regards to HIPAA?
We've not had anybody sign a special release form. It's I think the point that we like to try to get across is this is the same cardiac rehab that we all know and love. The only difference is we're connecting this way through the monitor instead of face to face on the treadmill. And you could be on a treadmill with somebody and the person next to you can kind of hear what you're talking about. So you caution people to be careful what you say. Don't divulge anything that you wouldn't want anybody else to know.
Yeah, I guess, and related to that, do you find that they share their weights as in the question here on a group call or any other kind of any of the other questions that you're typically asking? Do you find that people are reticent to share those as you're going through?
Not really. We've done like several thousand group sessions at this point, and I can only remember one person who had they had a body dysmorphia issue, and they really did not want to talk about their weight. So what we did with them was just like, so your weight's unchanged? Yep. And if they said, if they didn't answer, I just moved on. I'm not gonna. Well, what do you mean it's not the same? I just move on.
Yeah, gotcha. One of the other questions here, can you share what the onboarding process looks like? So if someone signs up for, to do virtual, what kind of onboarding or things do you do to prepare them that may be different from maybe doing the, traditional kind of in person, or is it different?
Different. Um, I'm speaking for myself right now, but my very strong preference is to have a few sessions in the facility where
Okay.
we're kind of like looking at your gait and sort of figuring out workloads that might be appropriate, asking about your equipment at home. But the onboarding session is where we would give you the link for the virtual session. I would give you my card. We would see what you're using to track your heart rate, whether you're using a heart rate watch or an oximeter or your palpation, how close is that to what we're getting when we do it here with our equipment? Okay. Um, and then describing like these same cardiac rehab again. Okay. Describing the policies. You got to be on time. You can't show up and 30 minutes into the virtual session. I'm not going to let you in. We schedule ours so that we have our set up so that you have to be admitted into the room every time. And that way we can use the same link over and over again, not have to worry about people crashing the party the way Stephen did earlier.
Maybe we'll take one more question here, and then maybe after that we'll take a break for our few poll questions, Emily. I think this may have gotten to a couple of the questions in there, but I was hoping that you guys could speak to what to do in case there's no exercise equipment. So I know we had one of our volunteers today doing yoga, and I think, Robert, maybe you were a little concerned at first about her heart rate and whether that was a reasonable strategy. And then the other question, I think that dovetails on that was in the chat, is there access to resources for people that need exercise equipment?
So I'll take the second half of that question first. So there's nothing formal in place statewide. There's not like a repository of stationary bikes hanging out somewhere near Midland that we just send them where they need to be. Um, but you can, if you don't have exercise equipment at home, you can see if you can borrow a piece of exercise equipment off of somebody, a family or a friend. Somebody's got an Airdyne somewhere in their basement with a bunch of clothes hanging on it. Um, you could, depending on what your insurance is, you could go to a gym. Okay. Planet Fitness is $10 a month. Again, can't do that if you have CMS. Um, exercise videos are fine, you know, and you can just walk. We've had people just walking, around, we call it free walking. And remember that CMS beneficiaries say that you have to be at the address on file. They don't say that you have to be in your living room. Okay. You could be in your yard. Okay. You could be walking outside. It gets a little bit weird, because you have people like kind of walking around like this, and, it gets a little bit weird, but it really doesn't come up all that often. And we're just trying to meet people where they are. We just want them moving.
Mhm. Great. Thanks so much for
I
all
think
of
I just
that.
wanted to dig in, see if, I know, Stephen or Diane, I know you've dealt with this. I didn't know if either of you had anything to add. I think that's a really important one. So I just wanted to see if others had additional kind of thoughts on the exercise equipment.
Go ahead, Diane. Well, at least from our perspective, Jesse, we try not to let it be a barrier. I mean, we have to also appreciate that virtual CR is not a panacea, right? It's not going to work for everybody. But in our trial work, we were above 84%. We could figure out an exercise modality. So that's going to help a lot of people that maybe we weren't going to get into the rehab program for other reasons that we're able to scoot in. But just think it through. Bob mentioned, a sibling or a child, someone from church, next door neighbor. Can we borrow this? Can we, find a different alternative mode to get it? If you push it hard enough, you usually can get to an agreeable spot.
Great. Should we open up the poll now,
Yeah.
Emily, and do those questions? And then everybody else in the meantime can also brainstorm other questions.
Yeah, so this is our first question, which is, what format of virtual cardiac rehab is your site considering? So I've just launched that poll. Currently at about 50% participation.
So quickly, Emily, while we're waiting, I don't want to take up too much time, but just to ask Robert, if somebody, correct me if I'm wrong, but if somebody's really hesitant or you sense hesitancy to start home exercise with a virtual model, have we not had the patient come to our facility and pretend like they're at home just so they work through the kinks and the mechanics and the logging in and all that stuff for a session or two before their own at home?
Absolutely. We've done that. We did that really early on in I-10, even in the pilot study back in 2016. Yeah, it's really important that everybody be comfortable with the virtual environment. So yeah, whatever it takes to get you there.
Great. All right. So it looks like we've got a decent portion of folks that responded to this poll, and we know that there may be some in attendance today that it's not applicable to. So I appreciate that. Overall, it looks like the vast majority of folks who responded are considering both, or kind of a hybrid style format for introducing virtual, with group and individual sessions. Okay, so we're going to move on to our second poll. All right, so this one asks what best describes your site's status in starting a virtual cardiac rehab program. We're considering, we're having conversations with staff and leadership, we're in program development, or we're actively piloting or delivering virtual cardiac rehab. Okay, and there's a couple of not sures coming through. All right, we're at 50%. So it sounds like most folks on the call are considering virtual cardiac rehab. I realize you can't actually see those results, so I'll share those. And our third and final poll. Why is that not launching? There we go. Okay. What other information would be helpful to cover at future events related to virtual cardiac rehab? Current options include billing, non-exercise related core components, demonstration of different virtual models or formats. So perhaps an individual virtual cardiac rehab session, safety management, or something else. And if you feel that something else would be helpful, there is an opportunity to fill in a short answer there. Okay. All right, we're at 50% again. I just wanted to see what folks kind of filled in. Okay. Share those results to you. Looks like vast majority would be interested in some other virtual models or formats for future sessions. Okay, that concludes our polls. I do believe there were a couple questions in the chat that we might have missed or didn't have time for in that previous question and answer session. Do we mind taking just a couple more minutes to answer those?
Yeah, I think one of the questions was how many patients are typically on a call at a time, or do you limit the number of people that you usually have in a session?
We're really well aware that nobody recommends specific patient staff ratios anymore. That was taken out of the guidelines several editions ago. We schedule up to 6 patients at a time. For me personally, handling, getting all the information, checking people in, you're documenting in the EMR, at the same time you're running the session, it gets pretty busy. So if with 6, usually somebody doesn't show up, we're back to that 5-to-1 patient ratio. Just how we do it.
Great. I think the other 2 questions I'm seeing. So what application are you using that is CMS compliant? So it just has to have real-time audio and visual communication and be HIPAA secure. So that's everybody can use a different one. It can, I don't, maybe Robert, you can say what you guys use, but Zoom, Teams are both reasonable options, whatever your health system supports.
Yeah, we were using Microsoft Teams up until pretty recently, and we're actually now transitioning. You can do group videos through Epic, and you can have up to 25 people on those. We don't need that capacity. but that simplifies things a lot. Now I have one less window open on my screens. I have support from the virtual care team here at Henry Ford if I'm having problems instead of going rogue and dragging some platform into the mix. And if you're through the EMR, then you don't have to worry so much about security. You do have to remind people not to like put their full name, address, social security number like in the when they sign in for the meeting. So that's not displayed on the screen. And also during the onboarding process, we talk about being careful about what you say. So you really can't commit a HIPAA violation on yourself, but it's a comfort level. You don't want people, if you don't want people to know that you have heart failure, then don't say you have heart failure. We're not going to bring it up.
And how important is target heart rate? I think that was one of the first questions up there that we may have missed.
I'll take it, and Stephen can chime in if he wants to. I think target heart rate range is nice to have. Okay, one of the criticisms, the early criticisms of virtual cardiac rehab is that you were not training at the same level of intensity because the patient wasn't right in front of you. And if you're not training at the same level of intensity, it's not realistic to expect the same level of outcomes. So if you can have a target heart rate range from a symptom limited stress test, that's the way to go. If you can't, you can't. I'm a very strong proponent of the talk test. Very, very reliable, easy to administer, but use the tools you have.
All right. I think the only question that we didn't answer that I saw come through in the chat was a question about Medicare reimbursement and the codes that are used. My understanding is that that could probably cover a whole other webinar. No, Robert's shaking his head. But keeping an eye on our time, I do want to keep us moving forward. So I think a resource related to billing is something that we've heard would be of interest. And we had a couple of folks respond to that poll related to additional information that would be of interest. And so we can definitely move forward on something related to that. Sorry, Robert.
Emily, just a quick add, if I could, about the billing issue. We all have a virtual care department or office or something like that. They exploded when COVID came through.
Mm-hmm.
But they also have a much better direct link to the billing people that you might not get if you just called, billing, like out of your phone directory.
Mm-hmm.
They're used to this kind of, virtual billing concept. So work with your virtual care department and see if they have a billing connection that is used to how to bill virtual services.
And kind of to build on that, there's only a few codes for cardiac rehab. You have the 93797 without ECG, 98 with ECG, and then you have the ICR codes that I'm not familiar with because we don't do ICR. And then you would need to have a modifier that said that was delivered through virtual real-time communication. I believe that modifier is RV, but I can confirm that. But it's billing's not hard.
Okay. All right. So one last thing, we noted that during the polls, there were many folks who were unsure of answers to those polls. We would encourage you, if you're at all considering virtual cardiac rehab, to perhaps take those questions back to your teams and see if you can, get any further information from your cardiac rehab teams about their interest in virtual care. We'll continue to have conversations around this through MiCR. All right. So with an eye on time, Rachel, would you mind sharing the post work group survey for folks who need to move on to another meeting? I'm going to just briefly share a couple of upcoming MVC work groups, as we usually do at the end of our work group sessions. So our second work group for June is going to be a health and action work group covering AI-enabled clinician feedback as quality improvement infrastructure. This will be presented by a couple of ED docs from Michigan Medicine. And then our first work group in July is a rural health work group covering post-discharge follow-up care for sepsis patients at My Michigan Standish. So if either of those topics are of interest to you, please register. A reminder that all MVC work groups occur virtually from 12 to 1. And then additionally, just a note that MVC's 2026 QI survey will be opening this week. And that survey will be due for P4P credit at the end of June on the 30th. And then lastly, if you have a presentation topic that you'd like to share with the collaborative, MVC is actively seeking presenters for our remaining 2026 work groups and other events. So feel free to submit a presentation proposal form. That form will also be included in the follow-up email. And yes, Jesse just wanted me to note that that QI survey link is going to be sent directly to our MVC site coordinators. So don't worry, not everyone is going to be expected to complete that survey. Okay, so that post work group survey is currently in the chat for anyone who needs to grab it. Thank you to our presenters, as well as to Mike and Jesse for leading our discussion portion, and to Emily, Jesse, and Rachel for being our patients. Double checking the chat, make sure nothing else is in there.